Chapter 14 of ICD-10-CM is for diseases of the genitourinary system. This presentation will cover the official ICD-10 guidelines specific to this chapter. There will also be clinical scenarios to practice coding what you just learned, followed by a small quiz at the end of the presentation. For each coding example, you will need to pause the webinar and use your ICD-10-CM coding manual to code the scenario. Once you resume the webinar, we will go over the correct codes, the rationale behind them, as well as how to locate them in the ICD-10 manual. Keep in mind that there may be more than one way to find a code. We are aware that there is a great deal of information contained in this presentation. Therefore, at any time during the webinar, please feel free to pause and reply as needed. It is important that you have already completed the Introduction to ICD-10-CM webinar, as you will use the conventions and general guidelines discussed in the introduction to complete the coding scenarios. As you can see on this slide, the codes for this chapter start with the letter N. If you remember from ICD-9, the genitourinary system codes all started with the numbers 5 and 6 and were found after the digestive system chapter in ICD-9. ICD-10 has shifted some of the chapters around so that the genitourinary system chapter now follows the musculoskeletal system chapter. One of the common conditions found in this chapter is chronic kidney disease, or CKD. There are 5 stages of CKD, and the stages go from least to most severe. The 4th character corresponds to the stage of the CKD. So as you can see on your slide, Stage 2 is N18.2 and Stage 3 is N18.3. End-stage renal disease, or ESRD, is coded to N18.6. If documentation contains a stage of CKD and also ESRD, you're only going to code for the ESRD as that's the most severe. With ESRD, there is an instructional note in the tabular stating, use additional code to identify dialysis status, which is code Z99.2. Code Z94.0 is for kidney transplant status and should be used as a supplementary code if appropriate. If the patient experiences transplant complications, such as failure or rejection, a code from subcategory T86.1 should be used to identify this. However, this subcategory is not used for patients who have chronic kidney disease after a transplant unless a complication of that transplant is specifically documented. So if a complication other than rejection, failure, or infection is documented, T86.19 is for other complication of kidney transplant. You would then want to use another code to identify the specific complication. Now I'd like to try some examples for this chapter. First, we have a patient currently being treated for Stage 3 chronic kidney disease. She has previously undergone a kidney transplant, but still continues to suffer from CKD. How would you code this? Please pause the webinar to complete this example, and then hit play to continue and learn the answer. The first code is N18.3, chronic kidney disease stage 3, which is moderate. To locate this code, you would start at disease in the alphabetic index and then find kidney. You then would look for chronic and then stage 3 indented below chronic, which points to code N18.3, which you would then confirm in the tabular. When you confirm in the tabular, there is a note which states, use additional code to identify kidney transplant status, if applicable, Z94.0. Therefore, the next code is Z94.0, kidney transplant status. If you didn't see the instructional note with CKD, you would start with transplant in the alphabetic index. And then once you're at transplant, you would find kidney. And this points to Z94.0, which you then would confirm in the tabular. Remember that even though documentation states that the patient still has chronic kidney disease after their transplant, this is not coded as a complication of the transplant. You have to have some kind of specific complication, such as failure, documented to code for a transplant complication. This next example is a patient seen with fever, malaise, and left flank pain. Urine culture shows Proteus growth as the cause of the UTI. Patient also has a history of UTIs over the past several years. How would you code this? Please pause the webinar to complete this example and then hit play to continue and learn the answer. The first code is N39.0, urinary tract infection, site not specified. To locate this code, start at infection in the alphabetic index, and then locate urinary with tract in parentheses. This points to N39.0, which you would then confirm in the tabular. In the tabular, there is an instructional note stating use additional code from categories B95 through B97 to identify the infectious agent. Therefore, the second code is B96.4, Proteus as the cause of diseases classified elsewhere. To locate this code, you would start at infection in the alphabetic index, and after infection, you would look for Proteus indented below it. Indented below Proteus is the phrase as cause of disease classified elsewhere, which points to B96.4, which you would then confirm in the tabular. As documentation states that the patient also has a history of urinary tract infections, this is also relevant to the encounter. Therefore, our last code is Z87.440, personal history of urinary tract infections. To locate this code, start at history in the alphabetic index, and then you want to look down through history until you get to personal. And just be careful that you're not under family history because this is personal history. From there, you would look for infection, and then urinary indented below infection, which points to Z87.440, which you would then confirm in the tabular. Next, we have a patient diagnosed with acute kidney failure due to acute tubular necrosis caused by a urinary obstruction. The obstruction was a result of the patient's benign prostatic hypertrophy, or BPH. How would you code this? Please pause the webinar to complete this example and then hit play to continue and learn the answer. The first code is N17.0, acute kidney failure with tubular necrosis. To locate this code, start at failure in the alphabetic index, then find kidney and then acute. Here there is a note which states, see also failure, renal, acute. After following these directions, find the word with, and then tubular necrosis indented below, which points to N17.0, which you would then confirm in the tabular. Here there is an instructional note stating code also associated underlying condition. The next code is therefore N40.1, enlarged prostate with lower urinary tract symptoms. Documentation states that the acute kidney failure was due to the acute tubular necrosis caused by a urinary obstruction as a result of the patient's BPH. To locate this code, start at obstruction in the alphabetic index. Then go to urinary, and then find the phrase due to hyperplasia with hypertrophy in parentheses of prostate. There's a note stating see hyperplasia, prostate. After following these directions, the options under hyperplasia, prostate are with and without lower urinary tract symptoms, which code to N40.0 and N40.1. If you didn't know that urinary obstruction is a lower urinary tract symptom, you would need to look up both of these codes in the alphabetic index. Under N40.1, there is an instructional note stating use additional code for associated symptoms when specified, and one of these additional codes is urinary obstruction, which is N13.8. Therefore, we know N40.1 is appropriate, and also that our final code is N13.8 for other obstructive and reflux uropathy. For the next example, we have a patient that presents with frequent urination with pain. The diagnosis is acute suppurative cystitis with hematuria due to E. coli. And E. coli stands for Escherichia coli, ESCHERICHIA. How would you code this? Please pause the webinar to complete this example and then hit play to continue and learn the answer. The first code is N30.01, acute cystitis with hematuria. To locate this code, start at cystitis in the alphabetic index, followed by acute, and then with hematuria, which points to N30.01, which you would then confirm in the tabular. There is an instructional note under category N30 stating use additional code to identify infectious agent categories B95 through B97. Therefore, our second code is B96.20, unspecified Escherichia coli, E. coli, as the cause of diseases classified elsewhere. To locate this code, start at infection in the alphabetic index, then find Escherichia indented below, and then indented below this, the phrase as cause of disease classified elsewhere, which points to B96.20, which you would then confirm in the tabular. For our last example, we have a patient presenting with proteinuria and hematuria. Diagnosis: chronic nephritic syndrome with diffuse membranous glomerulonephritis. How would you code this? Please pause the webinar to complete this example and then hit play to continue and learn the answer. The answer is N03.2, chronic nephritic syndrome with diffuse membranous glomerulonephritis. To locate this code, start at syndrome in the alphabetic index, then go to nephritic, where there is a note stating see also nephritis. After locating nephritis in the alphabetic index, look for chronic, then the word with, then diffuse, and then membranous glomerulonephritis, which points to N03.2, which you would then confirm in the tabular. Now it's time for our quiz. Our first question is true or false if both a stage of chronic kidney disease and end-stage renal disease are documented, code N18.6 is assigned. The second question is a code from N17 should have an accompanying code for the blank condition. You can pause the webinar to write down your answers and then hit play to find out if you were correct. The answer to our first question is true. You're only going to assign a code for the most severe stage of the chronic kidney disease, which in this case is end-stage renal disease, which codes to N18.6. To locate this code, you would start at disease in the alphabetic index and then find renal. Indented below is the phrase end-stage, which points to N18.6, which you would then confirm in the tabular. The answer to the second question is a code from N17 should have an accompanying code for the underlying condition. If you turned to category N17 in the tabular, there is an instructional note stating code also associated underlying condition. Remember, the United States will begin using ICD-10 on October 1st of 2015. After the October 1st compliance date, it will be very important to verify that claims are being received and to check remits for denials based on the ICD-10 conversion. This concludes Chapter 14 of ICD-10-CM, Diseases of the Genitourinary System. Please feel free to check out our webinars on all 21 chapters of ICD-10-CM. If you need further assistance with ICD-10 training for physicians and/or staff, please visit the VantagePoint website at www.vantagepointconsult.com or call us at 203-288-6860.